Bowel cancer is one of the most common types of cancer in the UK, according to the NHS. While it can affect people of all ages, it's mainly diagnosed in people over 60 years old. Bowel cancer symptoms can include persistent blood in your stool, a prolonged abdominal pain, or a change to your toilet habits. There are ways to gauge how healthy your bowel is by looking at your poo.This is everything you need to know about the link between your stool and your health. Color: a healthy colored poo is brown. According to Ramsay Health Care UK.You, you should look out for red or very dark colored stools, it said. Bright red poo may be caused by fresh blood. This is usually a sign of hemorrhoids or piles. But darker poo could be a sign of something more serious. Blood form higher up in the bowel, goes dark red or black, and can make your stools look like tar. This type of bleeding can be a sign of bowel cancer. Texture: your poo should be smooth and soft, it said. Aim for a sausage-shaped stool that's either smooth or has slight cracks on the surface. But a mushy stool, or one that's entirely liquid, could be a sign of bowel cancer. A change in bowel habit lasting for 3 weeks or more, especially to looser or runny stools, could be a sign of bowel cancer. Smell: a smelly stool is a normal healthy stool, according to the Taymount Clinic. Your poo shouldn't normally float, said the clinic. If your gut is doing its job, you should be digesting oils and fats which will make your stool sink. The odd floater is not an issue, but if it is a common occurrence, this can be a sign of bad digestive health. Sink or float: a healthy bowel should make stools that will sink. Your poo shouldn't normally float, said the Taymount Clinic. If your gut is doing its job, you should be digesting oils and fats which will make your stool sink. The odd floater is not an issue, but if it is a common occurrence, this can be a sign of bad digestive health. You should speak to a GP if you're worried about bowel cancer symptoms. Your doctor may carry out a quick rectal exam to make sure you have no lumps. Alternatively, they may suggest you take a simple blood test or arrange for hospital tests. The NHS offers bowel cancer screening for all men and women between the ages of 60 and 74. An additional one-off bowel scope screening may also be suggested by your GP. This is offered to patients at 55 years old and involves a small flexible instrument being used to examine the inside of the lower part of the bowel.